Welcome to this discussion and thanks for joining this initiative, Mr. Jairam Pathak. We are very glad that a person with a lot of grassroots experience and initiated a great deal of changes in the Swachh Bharat mission by way of supporting various district collectors in UP is part of this initiative, and we are sure that we will be learning a lot, and also the districts will be learning a lot from these interactions. And let me first introduce this broad initiative in a very brief manner. So into Swachh Bharat 1.0 to 2.0, we are seeing the transition, and at the district level, the district collectors and the block development officers, the CEO of the district panchayat, who is actually in many states leading the Swachh Bharat mission, and the block level team, the technical teams, and the panchayat elected representatives and the secretaries, they all are looking for some of the technical know-how about some of the missing links that was left over as part of the 1.0, so SBM 1.0. To correct them, to address them as part of the SBM 2.0. So we have identified some of those topics, and we are trying to interact with those individuals and organizations and organizational leaders who would have contributed significantly in some of these areas of work which otherwise getting not into full attention amid the missions critical goals around open defecation free. So how can they be addressed now is the question that we are trying to answer through this process. And we had several including the district and state administrators of the Swachh Bharat mission, leaders of the critical development partners and civil society organizations, and technical experts. So we have all the three categories of people coming and interacting with us in this process. So WaterAid is very glad to have you on this series of interactions, and I would request you, before we start the conversation, to give a very quick introduction about yourself, so that the listeners can understand whom are they listening to. Over to you.
Thank you, Mr. Raman. Thanks to you, thanks to WaterAid for giving me this opportunity. Myself, Jairam Pathak, I work with Aga Khan Foundation as a state team leader for Uttar Pradesh. So Aga Khan Foundation, currently we are in 8 districts. Particularly, we are working very closely in Devi Patan division. All the 4 districts of Devi Patan division. So since the first phase, Aga Khan Foundation is working very closely with government, and as per our mandate, we are supporting government and district administration in achieving the objectives of Swachh Bharat mission. So this is my introduction.
Yeah. Very glad that we are into this conversation. So your work has been known in 3 or 4 critical areas. So we will try to cover all of them. One, the one key area that I heard about your work is in ensuring inclusion of the most marginalized communities in specific districts. In Swachh Bharat mission, you have given suggestions to at least a large number of districts in UP, how to cover those excluded communities. And so what are the learnings that you can offer from that experience for those districts which are now prioritizing the coverage of those who are left left out from the baseline? So they are initiating to cover all of them. So how can they cover them, and what are the ways to do it, and how did you do that in Uttar Pradesh?
Okay, so definitely I will share my experience, Mr. Raman. So as I told, we are working with government and providing technical support to the government in implementation of Swachh Bharat mission. That is our core work. So in order to providing technical support, what we did is we supported government in training. And when it comes to training, we supported government in organizing training of pradhans, secretaries, block officials, activation of Nigrani Samiti, strengthening cadre of Swachhagrahis. Other than this, what we did is, when it came to the left out beneficiaries, we supported government in prioritizing the villages. When I say prioritizing the villages, we supported them in prioritizing the villages where coverage was low, the villages with high population, the villages where SC ST population was high, the villages where those beneficiaries coverage among those beneficiaries were low, particularly in SC SC community, women headed family. So that I think the first thing was prioritization of villages, within the villages prioritization of that particular habitation, and providing the toilet facility to them. So this order gave an quick result, and in these four districts where initially we were working, so the means government, the district administration could achieve the target of toilet construction. Other than this, what was the critical point was regular spot check and analysis of spot check data, discussing it during the district level meeting, let's say district water sanitation committee meeting, and identifying those area where focus is needed, those hard to reach areas, those areas where coverage was low. So this regular review and evidence based planning, that was very critical. And when it comes to the uses of toilet, construction is one part, but when it comes to uses, that working on the behavioral aspect to sustain the use of toilet, to the responsive use of toilets, we also supported government in preparing a SBCC plan. So that plan included a month-wise activity calendar, which can be very helpful in disseminating messages around responsive use of toilet, sustained use of toilet, and the general O&M of toilet. So, other than this, when the left out beneficiaries and universal work was done, we supported government on NLOB. So, same prioritization of villages, prioritization of habitation, identifying those households where toilet facility was not there, that was very critical. So, let's say we identified low hanging fruits, we identified those villages where लेफ्ट आउट बेनिफिशरीज का नंबर ज़्यादा था, तो उस पर हमने फोकस करके एट द सेम टाइम वी आइडेंटिफाइड, वी सपोर्टेड गवर्नमेंट इन आइडेंटिफाइंड मैसन एट लोकल लेवल, क्योंकि बाहर से मैसन को लाके उनको ट्रेंड करके देन उनको रिटेन करना वाज एन बिग इशू। तो उनको लोकल मेसन्स को आइडेंटिफाई करना, उनकी स्किल बिल्डिंग करना, उनको इंगेज रखना इन द टॉयलेट वर्क, टॉयलेट के कवरेज को बढ़ाने के लिए, दैट वाज वेरी क्रिटिकल।
So that is quite useful. So in this entire process, how the roles of block development officers and the Gram Panchayat officials and also the Swachhagrahis, or at that time there were prerats or whatever names
Yeah.
So how could you enhance their roles in identifying these left out people? Specifically, you told about women headed families and also specific caste groups and also specific employment groups. So these are the mentions that you made. So how could you make the block machinery and or the collectors make the block machinery and the panchayat machineries to prioritize these issues?
Yeah. So, Mr. Raman, we are working at every level. Let's say we are at block level, we are at district level. When we coordinate at the block level with the block level officials, इसमें what we did is कि we supported block coordinators, BDOs, ADOs in strengthening the Nigrani Samiti, the cadre of Swachhagrahis. Not only this means एक regular interaction का we made a provision so that कि एक regular interaction with these cadres can happen at the ground. So that was one thing, listening their problems, listening the progress, listening the challenges, and coming up with a very comprehensive plan. That was the key. Apart from this, we also identified few Nigrani Samitis, few Swachhagrahis, where they have done a commendable job, and coverage, toilet coverage and uses was very high. So we educated with government and we took them at the district level. We educated with government and means the government officials, they facilitated them, they felicitated them, they recognized their efforts. And by doing this exercise, the message was like कि among all स्वच्छाग्रहीज, among all निगरानी समिति working in the districts, एक बड़ा पॉजिटिव एक कंड्यूसिव इन्वायरमेंट बना कि यस आर एफर्ट्स आर रिकॉग्नाइज्ड if the panchayat is open defecation free in real sense, the entire effort of that panchayat is being recognized. So one side we facilitated the regular discussion with the Nigrani Samiti and Swachhagrahis. On other hand, we advocated to recognize their efforts where the work was very good. So it really geared up the process.
All right. So that is something, so what you are suggesting is that facilitating the processes and felicitating the leaders, these two are having a very important feature to play in terms of pushing the equity inclusion part. So you need to identify the champions of equity inclusion and you need to promote the processes. And then, you need to also recognize the efforts that these leaders and people are putting in.
Exactly, Mr. Raman. Means I would say that government has done a very commendable job. In UP, more than 25 million construction of toilet was not an easy task. But when it comes to sustained use, this community participation, the identification of influential leaders, identification of local influencer, engaging community to sustain the use of toilet, engaging community to regular operation and maintenance. This becomes very critical. So and this is the cadre through which you reach to the community. Na?
Sorry. So in some, specific instances, there are some districts wherein you people have supported a large number of community sanitary complexes as part of the SBM1. So what were the experiences of that, and how did they help, in order to, ensure usage of toilet by those people who don't have enough land for constructing their own toilets? And what all are the challenges that you faced in that process so that, whosoever is constructing community sanitary complexes at this point can learn from those both good and bad experiences, and how did you overcome those challenges?
So, as you rightly mentioned, Mr. Raman, the concept of community sanitation complex was this was the facility for whom, let's say कि the households जिनके पास land नहीं था, the floating population. So this community sanitation complex was a service for them. So we came up with a very basic checklist, and during our supportive supervision visit, we used to go to the place where community sanitation complexes was being constructed. So we administered that checklist, and we tried to interact with the local Panchayati Raj institution, Pradhan and secretaries, and try to ensure that the complex is being constructed within the habitation where it is required, right? So then that is one thing. If it is construction within the habitation where the requirement is high, the further O&M will be easier. So that was the first thing. As per the government guideline, there were three models as per the need. So again, we had supported government in capacity building of cadre of locally available masons. So they were bit trained in constructing individual household latrines. But yes, when it comes to community sanitation complex, or the targets were high, timeline was set. So I was saying that during our supportive supervision visit for the community sanitation complexes, we came up with a very basic checklist. We administered that, and we created a feedback mechanism. Means from that community sanitation complex, on spot training we did. We interacted with mason, we interacted with pradhans, we interacted with secretary, and with the community. And if there is anything to be escalated at block and district level, we immediately did that. We brought the issue into the notice of block and district level officials, and through which, means if we find that something is being happened at one gram panchayat, we assume that this can be happen in other as well. So taking that example, we created an mechanism of regular feedback and supportive supervision monitoring. So initially we did that, we came up with checklist and we educated it with government so that the government officials can also visit the community sanitation complexes and administer that checklist, and they can also come up with the feedback and suggestion. So on spot training of the masons, of the people involved in the construction of community sanitation complex, going back to the block and district level, that feedback mechanism, mid course correction when it is required, because once it is constructed, it generally becomes irreversible. So when it is being constructed, visiting at that time, providing handhold supporting and means at the spot, that was very helpful.
Right. So in this process, I have also heard that you have tried something for accessible community sanitary complexes. Although it did not go well in all districts, there were some districts who picked up that idea. So can you share that experiences? How the community sanitary complexes were tried to be accessible for the persons with disabilities, and what were the idea behind it, and why some of the districts found it difficult to adopt, and how some of the districts actually took that forward.
So, Mr. Raman, since it is community sanitation complex, so it is for all, and the people with disability, so excess of those person was critically means was very critical. So, in the community sanitation complex, where it was means construction of community sanitation complex, where it was elevated from the ground, we tried to give a suggestion that means preparing a ramp and means ramp with a railing to give ease in the access, and many places it was means the ये पूरा उस पे ग्राउंड पे और सरफेस पे ही बना था, तो वहाँ इशू इस तरह के एक्सेस का नहीं था, बट यस इन द प्लेसेस वेयर इट वाज एलिवेटेड फ्रॉम द ग्राउंड, वहाँ वी इंश्योर्ड इट कि इसके एक्सेस के लिए हम ये प्रोविज़न जरूर रखें, रैम्प एंड रेलिंग एंड अदर फैसिलिटीज थ्रू द एक्सेस कैन बी इंश्योर्ड.
तो ये जो चेकलिस्ट जो आप बता रहे थे, ये जो चेकलिस्ट है, इसमें एक्सेसिबिलिटी से जुड़ा हुआ कुछ बात था क्या कि उसको ऐड कर?
यस, इसमें एक्सेसिबिलिटी से भी जुड़ा बात था, इसमें विद इन द प्रमाइस रनिंग वाटर का भी बात था, इसमें कौन सी हम ट्विन पिच ले रहे हैं या सेप्टिक टैंक बना रहे हैं, इसमें अकॉर्डिंग टू द सिचुएशन इसका भी था, देन हैंड वॉशिंग फैसिलिटीज़ का भी था, तो इट इंक्लूडेड ऑल दीज क्रिटिकल एस्पेक्ट्स.
लिस्ट हम डेवलप कर लें डिस्ट्रिक्ट लेवल पे कि कम्युनिटी सैनिटरी कॉम्प्लेक्सेस के अंदर हम एसेंशियली क्या-क्या चीजें, प्रक्रियाएं और जो क्या-क्या मतलब आउटकम चाहते हैं, तो उन सारे चीजों को हम सम्मिलित करेंगे, तो वो ऑन स्पॉट मॉनिटरिंग के माध्यम से जो भी कमी है उसको सुधारते हुए उसको बेहतर बनाया जा सकता है.
राइट. एंड मिस्टर मन, आई वुड से कि उस चेकलिस्ट में लास्ट में ये भी होना चाहिए कि इफ यू फाउंड दिस please immediately means na talk to them on these topics, don't leave that open na. So
right.
that is my experience, that will be very critical.
वो फीडबैक देना बहुत जरूरी है लोगों को, और वहीं की वहीं जो है उसकी करेक्शन का प्रोसेस भी शुरू हो जाए, ये बहुत महत्वपूर्ण है. And then we were talking about toilet technology. You have included that in the checklist. But for toilet technology, in some districts, we would have come across this specific problem of what you say, the river basin kind of areas, high water table areas. And I know that you have been with the Indram Foundation collaborating on water quality and sanitation, how the sanitation is contributing to bacterial contamination of water in some areas, and you have done some good measurements and came up with some reports. So what are the learnings that you would suggest towards correcting some of the problems that has occurred as part of the large scale sanitation initiative under the Swachh Bharat mission? So what all can be done by a district magistrate in order to understand the gaps and problems in the toilet technology, and how can these be corrected? And in order to understand this, is there any activity that they need to take up?
Right. So, Mr. Aman, I would share one of my experiences which we implemented in the district of Devipatan division, particularly in Shravasti districts where we were working. We supported government in implementing a very innovative idea called ODF clinic. So ODF clinic was conceptualized to prevent ODF villages from slipping back. This was done through identification of issues with sanitation unit, helping households identify simple things such as regular maintenance, which they could undertake to improve uses as well as counsel households for adoption of safe sanitation practices. So, in this ODF clinic, we had come up with a toilet health card. So this toilet health card में what we were doing is कि when we go with this ODF clinic in a village, so the first step was organizing ODF clinic at village level, then sustainability assessment of IHHL, right, individual household latrine. Then, as I told, by administering toilet health card, we did a diagnosis of this toilets, and by doing a cap, which was again a tool to understand the behavior of community, means that further helped us and Swachhagrahis in counseling. Then, according to the issues which were coming out in toilet health card, we could understand कि in this toilet these are the issues, like single pit was constructed, was there any issue in superstructure, was there any issue in cleaning, was there any issue in availability of water. So this type of toilet health card we administered there in Shravasti districts. So on the basis of these findings, again we went back and we organized a meeting, or it's a orientation of Swachhagrahis and Gram Panchayat members, and discussed those issues. So that gave a fair idea that what are the issues of retrofitting is there at the ground, what are the issues when it comes to technology, because you understand that in the area where we are working, this is coming under Tarai region. So
Right.
water table is definitely high, but Mr. Raman, problem क्या है कि when it comes to UP or India, the scale is very big.
Yeah.
Scale इतना बड़ा है. Innovations happened at the ground, but that could not happen at the scale.
Right.
बहुत जगह बहुत सारे इनोवेशंस टॉयलेट टेक्नोलॉजी हुए हैं, बट स्केल इतना बड़ा था, नंबर इतने ज़्यादा थे कि उसको अचीव करने के लिए वो उस तरह उसका एडॉप्शन नहीं हो पाया. बट पर्सनली आई वुड से कि दिस टाइप ऑफ इनोवेशन लाइक ODF क्लिनिक कमिंग अप विद द टॉयलेट हेल्थ कार्ड can be a very good idea in diagnosis the health of toilet, in coming up with the different technology, means that tailor made technology. So
ये
that can be.
बहुत ही महत्वपूर्ण है कि जो टॉयलेट की हेल्थ को देखा जाए, टॉयलेट कितनी हेल्थी है, ये बहुत ही महत्वपूर्ण एक कंसेप्ट आपने चर्चा किया. सो व्हेन वी आर टॉकिंग अबाउट दिस टॉयलेट हेल्थ कार्ड, एंड यू आल्सो मेंशन द स्केल जो है कितनी महत्वपूर्ण है, कितनी मात्रा में हम कर रहे हैं. हमारे जो यूपी की जहां तक बात है, यूपी ऑस्ट्रेलिया से भी मतलब बड़ा एक
Yeah, 220 millions.
प्रदेश कहते हैं, लेकिन वो मतलब कॉन्टिनेंट से भी बड़ा है एक तरफ से देखा जाए तो हम ये देखें कि मान लीजिए टॉयलेट हेल्थ कार्ड को या उस तरीके की एक मेशर को, एक सिंपल मेशर के माध्यम से हम टॉयलेट्स की समस्याओं को जानने की एक तरीका निकालें. इसका एक स्केलेबल, कौन सी ऐसी चीजें बदलने से ये स्केलेबल हो सकता था? आपकी मतलब एक अनुभव आपका है और उसमें से आपका ये भी रियलाइजेशन रिफ्लेक्शन है कि वो स्केल अप नहीं हो पाया, तो लेकिन ऐसी कोई चीज स्केल अप करना होगा तो एक डिस्ट्रिक्ट कलेक्टर चाह रहा है कि डिस्ट्रिक्ट की सारे टॉयलेट की हेल्थ कार्ड बनाया जाए, तो वो आप उसके लिए क्या सुझाव देंगे?
देखिए मिस्टर रमन, आपके टॉपिक में द वन इम्पॉर्टेंट थिंग वाज मैनेजमेंट ऑफ चाइल्ड फीसेस, राइट? So, and if you see the verification checklist of ODF, that comes as a important indicator when it comes to declaring any village as a open defecation free. So personally, since I have also worked in health and nutrition sector, I would say कि when it comes to behavior, when it comes to sustained and responsive use of toilet, I think there is a need of convergence. Means convergence हुआ है, but somehow we should strengthen this. And जब child feces और इसके मैनेजमेंट की बात करते हैं, या इवन टॉयलेट हेल्थ की बात करते हैं, तो आई थिंक वी शुड enhance our coordination with other department, like I would say health and nutrition. Why I am saying this? Because SPM 2 में केवल टॉयलेट कंस्ट्रक्शन नहीं हुआ, इट वर्कड ऑन इन्वायरमेंटल क्लीनलीनेस, राइट. अगर गांव आपका ओपन डिफिकेशन फ्री रहेगा, you will witness the very less cases of childhood diseases, waterborne diseases, right, diarrhea prevalence. So it is also associated with health and nutrition. When it comes to child feces management, I think we should involve other frontline workers in the counseling of responsive toilet use and O&M of toilet. Let's say कि आशाज and Anganwadi workers, they are very actively engaged with the community in almost each and every hamlet, each and every village. So I think propagating the message of sustained use, responsive use through all the channels. If ASA goes and she's talking about child health, if Anganwadi goes and talking about child nutrition, if they could link it with the na, sanitation, I think na इसका भी इम्पैक्ट एक आएगा. सो अदर देन मीन्स स्वच्छाग्रही और निगरानी समिति, ये दिस एंगेजमेंट इज फाइन एंड दिस इज वर्किंग. But I think we should converge more with other department so that this message can be popularized.
All right. So now I am coming to one of the very critical issues that many Swachh Bharat Mission program could not prioritize in the way they should have been, because of these were coming into the ambit of other departments. We are discussing about other departments anyway, so I am bringing into the other departments. So the healthcare facilities run by the health department under the National Health Mission and related state level programs and all that. And Anganwadi under the ICDS program, currently Poshan Abhiyan, Poshan Mission, and of course schools under the Sarvashiksha Abhiyan or whatever name the states are calling. I know that you were able to get the Swachh Bharat Mission to extend their attention and their focus and then coverage of these facilities as well. And during the COVID also, you have done some very extraordinary kind of work for ensuring some of the hygiene facilities and all that. But it will be quite useful under the very target-oriented drive of the Swachh Bharat Mission. When the schools, Anganwadis and healthcare facilities were not into their radar fully, how were some of the districts actually prioritized them and focused them? How could you make that happen?
Okay, Mr. Raman, I would again take an example of districts coming under Devi Patan division where we are actively working with the government. So I would say कि I will take an example of Bahraich, where more than 3,000 schools in a very short span of time, government could ensure the separate toilet for boys and girls through this operation Vidyalaya Kayakalp and group hand washing facilities, right. So in Bahraich, what we did is we created few models by adopting few schools where we refurbished, we constructed separate toilet for boys and girls. We came up with a child friendly model of group hand washing for students. And what we did is we did not keep it to ourselves. We visited government officials with the complete drawing and design, with the estimation, with the budget, with the 2D, 3D AutoCAD design. We shared it with the district officials in the meeting of block development officers, ADOs, and like that with the education departments. So that has really helped. Means saying that you should have a group hand washing, you should have a baby friendly, child friendly unit in your schools. Sometimes that is not enough. As I would say again, I would say the scale is big. So you have to step out and go to that extent where you could really support the government and unlocking these things. So what we did is we provided the estimates, we provided the designs, we offered our support when it is in the construction phase. We visited the area, we took the samples, we again did the on-spot training, given feedback to the concerned officials. So this is how it happened in schools and Anganwadis. For Anganwadis, we also developed few model Anganwadis and demonstrated it to the districts. And I would say means in particularly in UP, and I would say where in other state I have worked, I would say कि when you come up with any successful model with which is low cost and which can be replicated, government means they are really welcoming, and they adopt it and they replicate it. That is my experience.
All right. That is quite glad to hear that, in a district setup, this can be prioritized, and there are ways of low cost designing, and in a considerable scale, although large scale is something that we are further large scale is something that we are looking for. So in that context, I have one question to you. In one Anganwadi center, what was the cost that was added by the Swachh Bharat mission or any other agency? Where that money come from? What was that amount? Similarly, for school, what was the amount and where did that money come from?
Okay, so what my experience is, Mr. Raman, in order to create wash facilities, I would say child-friendly wash facilities, it cost around 4 to 5 lakhs only. And means in few schools, we with our internal resources, we created these models. But when it came to scale up, means through the 14th and 15th Finance Commission, it came from Panchayat only.
Right.
So the main critical thing which was needed is, again I would say, convergence. The wash facilities means supposed to built in schools, but the money was coming from panchayat. So
Right.
here the education department and panchayati Raj department, they came together.
Swachh Bharat mission facilitated it.
Swachh Bharat mission facilitated it, and I would say here in particularly in UP, the leadership at state level in education department. So that is also commendable. So the convergence at that level could happen, and it percolated to the district and ground level.
So in that, in this entire discussion, what I see is that panchayats can be a backbone for many of these initiatives in the long run, particularly when the 15.
Undoubtedly, Ramanji. So my experience says कि the process of GPDP is very crucial. When you are preparing a school development plan, it should be incorporated in GPDP and the Gram Panchayat development plan. I think as a practitioner, we should offer our support. We should enhance the capacity of Panchayati Raj member. We should create an interface between school management committee and Panchayati Raj member, so that the school development plan or any development plan when it comes to institution, since institutions are where? Institutions are in Panchayat. Na? So when you are talking about institutional development, the plans should be incorporated into the GPDP. So I
Right.
think in coming days, if we focus on that, this will help.
One of the worries that several panchayat secretaries and pradhans or sarpans, whatsoever we call in different states,
Yeah.
told me was that their accounting capacities for taking out these initiatives were a major constraint for them to even plan, because they were worried about audits and various other things. So in UP, when this large scale, in a school 5 lakh rupees, in a Anganwadi center little lesser than that, when they were taking up these initiatives under the GPDP. How are these managed? Because that will be a very important insight for other districts. How can they get our panchayats into this specific role?
So, Mr. Raman, this is when it comes to the process, na, this I don't think this is difficult, as long as you follow the transparent process, right?
Right.
So, transparent process means now coming up with a proposal, organizing a open meeting in which the proposal of construction was facilities in school or Anganwadi or any health sub center. So right from open meeting to the proposal and to the approval of proposal at the Gram Panchayat level and involvement of all subcommittees and community. So that process is important. So in few villages we facilitated that process, and I don't think it's difficult. So, but of course, I would emphasize that participation of community and the transparent process. So, certain processes which are stipulated in the guideline, so that we should adhere that.
So in healthcare facilities, what was the process adopted? Because that is sometime, quite often they are serving multiple panchayats, not necessarily one panchayat. So one panchayat to finance a healthcare facility, if it is a primary health center or a community health center, may not be that easy. So how could you manage the healthcare facility part of it?
Yeah. So, Mr. Raman, we work very extensively with healthcare facilities, and you must be knowing there is a committee called Rogi Kalyan Samiti for each and every healthcare facility. So, when it comes to healthcare facility, that RKS, that Rogi Kalyan Samiti plays a very critical role. So, and the Rogi Kalyan Samiti has that power, has that provision कि उसमें उस एरिया के एसडीएम से लेके मेडिकल ऑफिसर सुपरिटेंडेंट इंचार्ज से लेके एनजीओ रिप्रेजेंटेटिव से लेके ये दीज ऑल आर द मेंबर ऑफ दैट रोगी कल्याण समिति. So again, I would say कि strengthening that Rogi Kalyan Samiti, streamlining the meeting of Rogi Kalyan Samiti, and highlighting the critical issues which are important for that particular healthcare facility is very important. So once you streamline these the processes, the regular meeting of Rogi Kalyan Samiti, and I would say when it comes to healthcare facilities, the regular assessment, and I would say the joint assessment, and I would say assessment by the providers who are working there at the facilities, right? Rather than not doing it by the external person like Mr. Jairam or Mr. Raman. So once we are able to institutionalize this within the healthcare facility, it goes like anything.
Correct. In couple of health facilities, I have also heard that you initiated biomedical waste management as well. Uh, One or two, if I am correct. So how could
Yes.
you did that, biomedical waste management, and was there any linkage with the SBM on that, and how the districts, were part of these processes?
Yes. So, for healthcare facilities, the biomedical management system, you know that in every district there is a agency. They collect the biomedical waste from the health facilities at the certain interval, and they take it to the common treatment center. This is how the whole process goes. But when initially we started working with healthcare facilities, the in few districts particularly, the problem was means कि वो vehicle रोज नहीं आता है, दैट एजेंसी के लोग वो बायोमेडिकल वेस्ट उठाते नहीं हैं. देन उठाने से भी पहले द अगेन आई वुड से कि द कॉन्सेप्ट ऑफ सॉलिड वेस्ट मैनेजमेंट, अगेन द सेग्रीगेशन बिकम्स वेरी इंपॉर्टेंट, एंड इट इज़ वेरी इंपॉर्टेंट व्हेन इट कम्स टू हेल्थ केयर फैसिलिटीज़, राइट? कि ह्यूमन एनाटॉमिकल वेस्ट कहाँ जाएगा, शार्प्स कहाँ जाएंगे, whether the facility has a pit for sharp disposal, where they have a pit for placenta disposal. They have segregated, they have all 4 5 bins in the labor room, in the operation theater, in the OPD, in the IPD or not. So again, in biomedical waste, segregation at source, this becomes very important. Even the agency can collect the waste in a proper manner when it is segregated at the healthcare facilities. So initially we focused on that कि ये segregation at the facility can be ensured. इसमें फिर again whatever feedback was there, हम observe करके कभी नहीं आए. We did the observations, we sat with the medical officer in charge, again we discussed it with them, and the issues which were needs to be escalated at the district level, we took that into the notice of district collector and chief development officer and chief medical officers.
So how these be mainstreamed into the SBM's larger landscape? That is also something that the SBM leaders at the district level, whether it's a collector or a CEO or the SBM program coordinator, whosoever, if they want to take up the health facilities into their landscape, how can they do that? What should be their ways to do that?
Okay. See, Mr. Raman, in our in area where we are working, the load at healthcare facility is quite high. You know the reason that the first level of care that is a problem somewhere. So block level facilities are overloaded,
Right.
right? So if the I have seen 400 OPD in a day in few block level facilities.
Right.
Just imagine 400 outpatient in a day, so the load is quite high. So considering that these many people are visiting healthcare facilities, if you have emphasized the clean India, if you see the Swachh Bharat mission, has really turned into something. So you have to make a provision of sanitation facilities at institutions as well, and the institutions where 400 people are visiting in a day. So
Yes.
accordingly, we advocated with the health department to come up with the toilet facilities in an adequate manner.
Right.
We should also come up with a operation and maintenance system for these facilities. Like in few places, toilets were not available or not working in the maternity ward, in the labor room. So now very few things were supposed to do. बहुत छोटा छोटा काम करना था, एंड इट कैन बी मेड फंक्शनल, राइट?
Sure.
बट यस, इसमें अगर एसबीएम की हम बात करें, तो विदाउट इंश्योरिंग वॉश फैसिलिटीज एट इंस्टीट्यूशन, इट कैन नॉट बी डन। एंड
Right.
मेरा एक्सपीरियंस जो हेल्थ केयर फैसिलिटीज़ और आंगनबाड़ी या स्कूलों के साथ काम करने का है, वो यही है कि इफ़ यू वर्क इन अ प्लान्ड वे, इसमें इसमें कोई मुश्किल नहीं है, फंड्स का कोई प्रॉब्लम नहीं है। रोगी कल्याण समिति इज देयर, जननी सुरक्षा योजना इज देयर, इम्यूनाइजेशन फंड इज देयर। इन ईच एंड एवरी स्कीम वी हैव दैट ना एडमिनिस्ट्रेटिव, some administrative provisions. AMC is also there, Untitled fund is also there. You know that. So fund is not any
So
constraint.
if they attain the open defecation free status, the block or whatever, so the new program called Swachh Swasthya Sarvatra can give a incentive grant as well.
Exactly, yes. Mr. Aman, I would say कि this is a high time when ना toilet construction हमारा काफ़ी हो चुका. I would also say कि uses is quite impressive. But this is a high time when we should focus on wash in institution.
Yeah, that was one of the purpose that we were trying to focus as well. So I think I have covered most of my questions as part of this discussion. So in case I have missed out any critical points wherein you think mentioning them are very important, please add those points which I would not have explicitly asked, but maybe for a district level you would have thought that these are very critical. Please feel free to add them.
Yeah, Mr. Raman, I would add two things. One is a year back we had a discussion. WaterAid was also there in that meeting. We had a discussion and discussed to come up with a very comprehensive manual on retrofitting of toilets. Right. So, abhi we attained those numbers na, of toilet construction. There
Right.
is a high time when we should implement this concept of retrofitting. इसका डायग्नोसिस शुरू हो, इसका इस पे काम शुरू हो. Then again I would say कि our experience says in few villages there are, I would not say that is septic tank, but that toilet with that collection chamber. So that now taking the fecal sludge management even in peri-urban and rural areas,
Right.
that should also be a focus in SBM2, which is I think that is there. And in UP, government of UP took a very good initiative by handing over this community sanitation complex to the SHG members.
Right.
Right. So now our role is very critical, that we should go to the ground and demonstrate few model of O&M, right?
Right.
And particularly SHG led, women led model of community sanitation complex. So ये जो asset हमने create किया है, ये इसका utilization होना चाहिए, and these assets are really very useful at the ground.
Thanks a lot, and it was a very useful discussion, and I'm sure that this insights from this discussion will kind of enlighten the thoughts and processes in several districts. So glad, Mr. Jairam Pathak, that you could join us, and of course, some of these discussions, I hope I'll extend this to a visit to some of your programs, and traveling with you will be a
High pleasures.
pleasure. Yeah.